Thank you so much to all of you for joining us at the Women's Commission today for a conversation with our State Secretary of Health, Dr. Umair Shah, facilitated by Commissioner Anna Franklin. We're really grateful to have both of you here today. Dr. Umair Shah, MD, MPH, was appointed Secretary of Health by Governor Inslee this time last year, and prior to this, Secretary Shah served as Executive Director and Local Health Authority for the Harris County Public Health System, a nationally accredited county public health agency for the nation's third largest county with nearly 5 million people. Over his career, Dr. Shah has been a clinician, an innovator, an educator, and a leader in health leadership. He began this distinguished career as an emergency department physician before starting his formal public health journey, which included an international health policy internship at the World Health Organization. Dr. Shah currently holds numerous leadership positions with respected entities like the National Academies of Science, Engineering and Medicine, the U.S. Centers for Disease Control and Prevention, and previously served as president of the National Association of County and City Health Officials. Really grateful that our Commissioner Anna Franklin, one of 9 appointed commissioners to the Washington State Women's Commission, who's with Providence Healthcare, has over 20 years in multiple facets of the healthcare industry, and we'll be conducting this quick round of questions with you, Secretary Shah. For your information, Anna currently serves as Executive Director of Diversity, Equity, and Inclusion for Washington and Montana, and previously served as Director of Clinical Effectiveness at Providence, where she led various large-scale improvement initiatives in the healthcare sector for universities, state agencies, health insurers, hospitals, and clinics. I'm so excited to have an opportunity to hear from you both today. Wanted to let our audience know that since we have limited time this morning, we're doing a quick 15-minute round of questions with Secretary Shah, but we have disabled the chat as a result of limited time. However, if you go to our website under the page for this event, you'll find a link to a Google form. You can submit any questions that you might have for Dr. Shah there, and we will have a written follow-up from his office that will be posted to our site in about 7 days. So without further ado, I'd like to pass it on to Anna Franklin, Chair of our Health Committee, to begin our questions.
Thank you, Regina, and thank you for joining us, Secretary Shah. We are so happy to be here with you today. I've been in healthcare for over 26 years, and as a mother of 5, I've had my own hesitancy about the vaccine. However, I have been able to do my research, and I was able to discuss my concerns by speaking to my physician and also to friends that I have in the medical profession. I also felt that I had the information to make a decision, and my younger children are now vaccinated. I know the pandemic has been very, very overwhelming for many of us, and there's so much misinformation floating around. How do we know that the vaccine is safe for our children?
First of all, Commissioner Franklin and Regina, thank you so much for having me. And today is Public Health Thank You Day, and I just want to thank all those who have really been just championing public health and the messaging of prevention throughout our communities. I would say that really there are a couple of things that we need to just keep in mind. One, that these vaccines are safe and effective. And why do we know that they're safe and effective? It's because they've been studied. That's the reason that they have been released to all of us, is because they have gone through an incredibly rigorous process of safety and making sure that both Pfizer and Moderna and J&J vaccine here in the US, that they're safe and effective. And for a Pfizer vaccine, particular for kids, they're safe for kids. And I will tell you, this is, I've gotten vaccinated, my elderly mother has gotten vaccinated, my wife has gotten vaccinated, and guess what? My 12-year-old has gotten vaccinated. And now, just this last week, our 7- and 5-year-old sons got their first dose of Pfizer vaccine as well. So they're safe and effective because they've been studied, they've been reviewed, and they have been made sure that before we give them to people, that they are safe for them and also that they can prevent them from getting sick.
Thank you so much. Our second question is surrounding existing illness. So if a child has recently recovered from an illness such as the flu, COVID, strep, etc., how long should a parent wait until they have their child become vaccinated?
That's a great question. You know, this is really about vaccination should wait until the quarantine period has ended, so that you don't potentially expose either the personnel that are giving the vaccine or others that are at the vaccination site from getting whatever it is that that child may have. And that also applies to people with known COVID exposure who've received their first dose of mRNA vaccine but haven't gotten their second dose. In other words, they're not fully vaccinated. So I think the key message is that a parent should wait if they're not sure. They should contact the healthcare provider or the public health department and ask the question, look, my child is recovering from an illness, whether it's flu, COVID, or something else, and we want to make sure that my child is safe to get the vaccine. What do you think?
Wonderful. And we will be listing some of those resources that Secretary Shah just mentioned at the conclusion of today's interview. So as a follow-up to that, that leads me into my next question. If a child has already had COVID, is it necessary for them to receive the vaccination, or are natural antibodies enough?
Oh my goodness, this is the, don't get me started. I know we don't have enough time. Absolutely, they should get vaccinated, because we know that vaccination is what I would describe as a more consistent, constant way of protection versus not truly knowing if a child, or an adult for that matter, if you get COVID-19, we don't know how long your immunity lasts. It may last a month, it may last 3 months, it may last 2 months, it may last 6 weeks. We just don't know. And so with the vaccination, we know that there is a consistent and constant protection that is in play for a longer period of time. Obviously, we know boosters are needed, because I just got my booster along with my sons who got their primary vaccine on Thursday of last week. And my wife got her booster earlier last week. Why did we get our boosters? Because we know that there is a naturally waning immunity that's going to come from this vaccine, that these were not vaccines designed to be one time and for the lifetime. That's all you need. They were designed that there were going to be time, and we've been saying from the beginning that you were likely going to have to get a booster. And obviously we're really excited about the fact that now boosters have been opened up to a larger swath of people. And the key message is, if that you're past your 2 months of J&J vaccine or the one shot, you're eligible for a booster potentially. And if you're past 6 months of your Moderna or Pfizer vaccines, you're eligible for boosters. Again, a lot of information that I can't pack in right now, but absolutely get vaccinated. Do not rely on somebody getting ill or sick and trying to naturally try to move through this, because that is an inconsistent, and honestly, you're putting people, your own self at risk. If you say, I got vaccinated, I got COVID-19, and therefore I'm not going to get vaccinated, you just don't know what kind of protection you're giving yourself and for how long.
Thank you so much. So we hear you loud and clear. Definitely get vaccinated. So our next question is about first dose. So if a child has received their first dose, is that dose enough to protect them around other family members during the holiday season?
It helps, but it's not enough, right? It's necessary, but not sufficient. And we know the Pfizer vaccine for kids is going to be more than 90% effective once they are fully vaccinated. Fully vaccinated usually not usually, it does mean that it's after your second dose, 2 weeks after your second dose. So you get your first dose, then you wait a few weeks and you get your second dose. 2 weeks after that is when you are fully vaccinated, fully protected, and that's when you're going to be fully able to get that protection for, let's say, holidays or what have you. But that doesn't mean somebody should say, well, gosh, it's too late for me to get the full protection, so I'm not even going to start. No, you get started today. Get your kids vaccinated today, because that process has started. My wife and I already feel better because our 5-year-old and 7-year-old are already getting, their their vaccine protection started. They're not fully protected. We know that. Thursdays they got their vaccine. It's only Monday, but we also know that it's going to get more and more protection as they get further along from their primary vaccination. And then when they get their second shot, they will be even more protected. And then 2 weeks after that, they will be fully protected. And that's what we're looking for. So yes, 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 get vaccinated. Key message.
Awesome. Thank you so much. So in our last few minutes together, it went so fast. Is there any message that you, Secretary Shah, would like to convey to the audience as we embark upon the upcoming holiday season?
Well, a couple of things. First of all, get your COVID vaccine. If you have already gotten your primary vaccination earlier, thank you. And number two, get your booster. Number two in this is if your kids have not been vaccinated, and it was a little bit hard to get vaccine appointments. It took, my family took us a couple of weeks too. And guess what? But we got it. And we went online to Vaccine Locator. We found where the pharmacy was, and we made our own appointments, and we made it happen. And so now our kids have gotten their vaccine. So get your kids vaccinated. That's the second message. The third message is it's not just about COVID, it's also about flu. So get your flu shot. Make sure your kids get their flu shot. And then I think the key message is the holidays are here, and we want to make sure that people are doing the right things around the holidays. So if you have fully vaccinated people coming to your house, great. Make sure that they are fully vaccinated, right? If they're not fully vaccinated or they have not been vaccinated, you've got to still wear masks, and you got to really make sure you're not keeping that gathering big. It's got to be a smaller gathering, and please be careful if you travel, because you may be going in transit somewhere where you may also be exposed, but also where you go somewhere else where there may be additional unknowns about COVID-19 or their vaccination coverage, and you want to make sure that you follow that. And then my final message is that I have been around an incredible, amazing women my entire life, from grandmothers to aunts to mothers to sisters to my wife to my daughter. And I will tell you, I have just an incredible amount of admiration for the strength that women play and have and play, and the role that they play in our families, in our communities, and really making sure that we're safe and sound. And I just would be remiss if Thanksgiving, I also didn't thank all of women out there who have done just an amazing job, trying to be single moms and trying to make sure the kids are, they're working, and also kids are going to school, and being, the teacher at home, all those things during this pandemic. It has not been easy, but I would just be remiss if I didn't say thank you to you for what you're doing, but also please continue to keep that message up of how you can continue to protect yourselves and your family members. And if you have some men in your lives who have not gotten vaccinated, who aren't doing the right thing, please kind of cajole them and actually make the appointment and get them vaccinated, because sometimes we don't always listen, as my wife always tells me. With that, I just want to say thank you for having me today. It's been a great honor, and I hope we can have a longer conversation next time.
I agree. And thank you so much, Dr. Shah. We, on behalf of the Washington State Women's Commission and women and families across the state, we really appreciate you and what you are doing for our community. It's really been very important for us to have this conversation with you today, and we know that you have to go. So for everyone still on the call, we wanted to point you to the Washington State Department of Health and CDC websites to find out a little bit more information and some answers to commonly asked questions. As Regina mentioned earlier, the Google form to ask questions to Secretary Shah's office is on the Women's Commission website. Please click on the banner to find a page for this event, and you'll find a link to the form there. The form will stay open until Friday at 5 p.m. and we'll be working with Secretary Shah's office to respond to them in a follow-up blog post on our website. Thank you, everyone, for all that you are doing and for joining us today, and have a very wonderful holiday season. Bye-bye.